I know sometimes when people think about robotics, they think they're taking jobs away. And that's not what we want to do here. What we want is to embrace our staff and give them tools to be able to spend more time with our residents and use the robotics for those tedious tasks sometimes that takes up our staff time when they could be spending that with our residents.
Hi, welcome to Robot Lab's Breakfast Byte. Today we're joined with Autumn and Cami to talk about Mobii and Pepper. So what inspired this relationship between St. Francis Health Services and Robot Lab?
So when you think about robotics in long-term care, your mind doesn't drift to there. It usually thinks about more of your big top industries. So first off, it was surprising to our staff, to our residents, to our families when they heard, wow, you're gonna have robotics in your care center? That's amazing. And then once we brought them in, we saw such a difference in interaction with our residents. At my building, I have residents who never would come out for any activities, not even bingo, which bingo is a huge hit in our industry. But now they come out for Mobii, and that's huge. And if we can touch even a few more lives and a few more interactions with the technology that we brought in, that's a win for me. And we want to keep doing more of that, and we want to keep engaging our residents and having that fulfillment that they look forward to their day because of interacting with Mobii or interacting with Pepper.
It really did align with our what we want is high quality care in an environment that is conducive to engagement and fulfillment of people's lives. And that includes staff and residents. It is really intended to be an extension of what we already do and really enhance it and to give a different variety, be some innovation, being able to expand, to be able to address that. Also, as Autumn pointed out, with staff, sometimes it can be difficult to take the initiative. It can be difficult to know what else is out there. And so this technology really helps us enhance what we know we should be doing, enhance the interaction, and really allows staff also to have more interaction. When Pepper is calling bingo, we can have a staff member then assisting people with filling their cards for bingo. When staff are running or they can help residents. So it becomes an adjunct to the services that we can provide.
It also opens up the opportunity for other caregivers other than our activities staff to engage with the residents, especially in regards to Mobii. If we have a resident, let's say in the evening, and they're up, maybe a little agitated, we can bring Mobii out as a CNA, and they can start a one-on-one activity with that resident to maybe calm them down or make them feel a little bit at ease. I have witnessed at my setting that some of the residents who have maybe early onset or even advanced dementia, they sometimes don't have a certain activity to look forward to. In regards to Mobii, that has completely changed that stamina, that they remember Mobii. And as soon as they know that Mobii's gonna be an activity for that day, we have our residents fighting to get to the table first because they want to be a part of that. Their mood has definitely changed. They seem more happy, more engaged. They look forward to the activities. I just love what Mobii has done at my setting, and I look forward to what Pepper can also do to the other settings, even providing that one-on-one care. We have one resident at a building that loves to sing "You Are My Sunshine." And as much as I would love to have a staff member sitting there with her, we always don't have the staff to provide consistent one-on-one care. With Pepper, we can do that. We can have Pepper in there and sing "You Are My Sunshine" with a resident, or read a book to a few residents and engage in conversation of a book club. So that is really powerful, and knowing that we have these tools to provide that when we always don't have the numbers and staffing to do that.
movement alone. Movement alone is going to help people have a better outlook of life in general and a better mood. And so getting people involved in movement, being able to see different things, to hear different things, and to use all the senses, we know improves quality of life.